So thank you, Ken, for that introduction. My name's Ashley. Like I said, I recognize a lot of you from last year, so I just want to say thank you for having me back. I really appreciate this opportunity, and it's an amazing, and I think even Kiva's story, which is just beautiful, really just kind of hit home, and I think brings another purpose to doing more research, like Dr. Scott had talked about earlier this morning as well, and just trying to, start the path to find some answers. And so that was kind of my role last year, and doing the survey, and I appreciate everybody's help that was able to participate, was just to start to establish some sort of understanding as best we could. And again, the caveat, I'm not a geneticist, I'm just a genetic counselor at this point, so I wasn't in the lab doing research, it was just a survey, but we at least could try and get some sort of answers or start to, further other research into what happens as young kids with 1p36 deletion syndrome as they get older. Is anything changed? Does anything get different? So that was kind of my ultimate purpose and goal to doing the survey. So currently it is in the editing processes, I guess, and then we're hoping to be published this summer. So that would be available to other, physicians, geneticists, and I'll certainly let Ken know and hopefully spread the word when that does get published, so everyone can kind of be aware. So just want to thank Dr. Hopkin. He spoke last year, and he's another avid proponent of 1p36 deletion, trying to spread the word, get the word out. So, and then Kevin and Teresa were on my committee as well that helped with the research. And I really want to thank Ken, like I said, and everybody that was able to participate and fill out the survey or knew a friend who had a child that was eligible to do so. The purpose, so this really came out of suggestions from this group, is again wanting to know what happens as these little kids with 1p36 deletion syndrome as they get older, because the research out there is just, it's not, there's not a lot right now as far as the progression of 1p36 deletion syndrome. So that was the ultimate purpose, and then to further additional research projects after. Oh, okay. So everyone's very familiar with 1p36 deletion syndrome, but we're just going to go through a brief background as well as kind of how we went about doing this survey. And then when we get to the results part, this is again, just from data collected through primary caregivers of people with 1p36 deletion syndrome or individuals of themselves. So nothing was, we weren't able to see these people in clinic. So we weren't able to get, the specific deletion size on everybody to be able to correlate that. So this is just what parents or primary caregivers or individuals reported. So it is now, what's published in the literature, this is all going off what's currently published, is that it is one of the most common terminal deletions. So again, looking at the topmost part of chromosome 1, one of the most common terminal deletion syndromes that are known to date. And the estimation as far as, how many people do end up having 1p36 deletion is anywhere from 1 in 5,000 to 1 in 10,000. Again, this is all data you guys are probably very familiar with. And it was first reported in 1981, so again, going off the fact that this is very new, people that were diagnosed 10, 15 years ago, there wasn't much information at all on this. So we're learning more and more every day, and this is just kind of a testament to that. And there are common facial characteristics, and that wasn't something that we looked at in the survey because, again, we just couldn't physically, examine everybody in clinic. This was just an electronic survey. And so as far as other systemic problems, these are ones, again, that are currently reported in literature, and so we wanted to see the data that we got and compare it to what's out there already. So currently what they say, anywhere from 50 to 79% of people can have seizures. Hypotonia, so the low muscle tone, can continue to be a problem. And again, this is in younger children, what's already reported. This is not the data that we had. So cardiovascular, so the congenital heart defects, going back to the VSD, like Dr. Scott had talked about earlier, and cardiomyopathy had been reported as well. Some kidney problems can also be associated with individuals with 1p36 deletion syndrome. Some people, anywhere from 30 to 67%, can have difficulty controlling eye movements. They also might have nearsightedness or farsightedness. Some individuals, up to 2/3, may have hearing loss. There can be difficulty, especially feeding in infancy. There can be problems with reflux in infancy, and other just sort of digestive system issues. They, again, previously reported that speech development can be almost universally delayed, as well feeding and toileting. There hadn't been great report or evidence as far as toilet training, kind of what that looked like in individuals as they got older with 1p36 deletion syndrome. But feeding, anywhere, I think Unique had reported 47 to 77% of individuals can have difficulty in infancy feeding. Mobility, there wasn't, again, lots of data as far as individuals, what happens when they get older, if they can walk, if they are in wheelchairs, things like that. So it just basically, it was delayed as what had been previously published. And behavioral, there had been some concerns, like maybe individuals are typically really happy or possibly some autistic-like features. So lots of questions to try and answer, and we got a lot of data that we tried to sift through. There had not been great report at all on what happens as far as physical development or puberty. So we tried to sort of ask questions about that, again, it being a little difficult because it was an electronic survey, so we didn't see anybody in clinic. And there had been reports that some of the, in the region that could be deleted on chromosome 1, that some of those genes are associated with cancer or tumors developing. So we wanted to kind of ask some questions and explore that area as well, because there hadn't really been, there have been a couple of case reports, but not a lot of systemic data. So we sent out an electronic survey, and we used the 1p36 DSA, as well as Unique and another online support group, Chromosome Disorder Outreach. And we sent out the survey electronically, and we also had a small cohort of patients at Cincinnati Children's Hospital that we sent them a letter in the mail as well, asking for their participation. And participation was completely voluntary. So we asked a lot of questions, and appreciate, again, anybody that took the time to fill out the survey. We came up with the survey based on what had previously been reported, as well as kind of, thinking long-term, so thinking puberty development, thinking if cancer might develop later in life, things like that. And, okay. So these were all the areas that we asked questions in, kind of hitting all those main systemic things that we reviewed earlier. Again, what had been previously published. So again, as we go through these results, there's a lot of numbers. So bear with me, but it's kind of just the data that was generated. So we had 50 people that tried to complete it, and then we had to discount 10 of those based on age requirement, because we did have an age requirement of 12 years old, just so we could try and get an older population, and or if they just didn't finish the survey, things like that. So we ended up including 40 out of 50 in the analysis. Females' ages range from 12 to 46, and males' ages range from 13 to 34. And the average age between the two was 19.7 and 19.2, so there was no difference really when you look at it statistically. So we felt like we were comfortable comparing males to females in our survey. So this is just going over how people were diagnosed and where we got our population from. So the first diagnosis, so FISH, that is looking, it's like a specific target looking to see if that area on the tip of 1p36 is there or not. And so that is more of a little bit of an older technique. And so again, looking, because our population is a bit older, that kind of makes sense that they would be using an older technique compared to the newer one that Dr. Scott was talking about, which is the microarray. So we had about 18% of individuals that were diagnosed by microarray. And then the karyotype is just looking at the picture of chromosomes, and so sometimes you can see that missing piece if you just look at a whole picture. And so we had 25% of individuals that were diagnosed by karyotype. Unique, because if it sounds like you guys are familiar with Unique, and so that reaches outside, of the United States, and so we had some individuals from New Zealand, from the UK, and Australia participate as well, but the majority were from the US. So looking at digestive system and kidney problems, this is what we found in our study. So individuals still had some problems with constipation, diarrhea. When we asked about kidney infections, we just asked if they had any in the most recent month. So if we figured, females, they had a little bit more kidney infections than males, again, just because males there were 11 and females there were 29 participants. Abdominal pain, ulcers, also not as common. And so we, kidney infections were a little bit more common than we had anticipated necessarily, but it could be because of maybe hormonal problems or as people just got older, they, for some reason, so had a little bit more kidney infections. So looking at the central nervous system, we first wanted to ask if people had a history of seizures compared to whether or not they developed seizures. So a history of seizures, we had 7 males had a history of seizures and 24 females had a history of seizures. Now let me get my data because some of it was able to be corrected with medication. I wanted to give you those numbers there. So out of those individuals, though, 10 out of 24 females still had seizures, and then 3 out of 7 males still had seizures. And so I want to, let's see here. Okay. So in 2 cases, the onset of seizures were at the age of 15 or older were documented. So most of these seizures, the onset was fairly young. And then as individuals aged, it looked like from our data, seizures tended to decrease in frequency or potentially stop. And so some of those were due to medication, just finding a really good balance and being able to control the seizures very well. Others just outgrew them and they weren't on any medication, but they just no longer were having seizures. So those were 2 potential, we hypothesized 2 potential reasons why seizures may have decreased. We also noticed, so hypotonia, again, is the low muscle tone, which can cause problems as far as trying to learn how to walk and just with overall strength. And so that had been documented in babies and really young toddlers with 1p36 deletion syndrome, but hadn't really been documented in an older population. And so we found that 55% of males and 69% of females were still hypotonic, so they still had low muscle tone. So things like physical therapy are really helpful with hypotonia to just really continue to build on the muscle strength. Let's see, contractures are just when the joint isn't able to move all the way or it's kind of stuck. So that wasn't as common, and we just asked about brain anomalies as well, which are that the people would have been born with, so nothing that was developed over time. And those included hydrocephaly, microcephaly, enlarged ventricles, decreased myelination, so just the folds in the brain were not as they should be, and then a benign arachnoid cyst. And then others were just not sure. So then we asked about hearing problems. And 55% of individuals didn't have any hearing loss at all. Then we also got into the conductive or sensorineural. So conductive is kind of more on the outside, having difficulty hearing that, the outside of the ear. And then the inner ear is a sensorineural. I never can say that. Having problems conducting to the brain, so having difficulty hearing that way. So we asked about that. And then as far as vision problems, so myopia is the nearsightedness, and strabismus is difficulty keeping your eyes aligned, and hypermetropia is farsightedness. And so vision problems tended to be more common compared to hearing problems, and only 20% of individuals reported no vision problems. But that was pretty consistent with what had been previously reported in the literature. So then talking about heart problems and heart defects. There hadn't been, again, good characterization as far as cardiomyopathies and things that develop later in life. So to do that, we first asked about just heart defects that people were born with. So not what they currently have, but this is what they were born with. And they could check more than one, so this adds up to more than 50 participants necessarily, or 14. So Those were the most common. So a VSD, or ventral septic defect, which Dr. Scott had said earlier is very common. That was the most common we found that people were born with. And then a patent ductus arteriosus was the second most common, and then you can see it goes down from there. So then we asked about cardiovascular problems that developed, and I'm going to get this out too so I read it to you correctly. Okay, so we had 3 males and 4 females report that they developed a cardiac disease or cardiomyopathy or something like that. So I'm going to go through the 4 females and the 3 males, the case reports, just to kind of give you an idea of what individuals reported they were born with compared to what they developed. So there was a female who was born with a VSD, a PDA, and an Epson's anomaly, and she was diagnosed with cardiomyopathy at 16, but she's now 20 years old and was doing well. There was a male that was born with a PDA, an ASD, and a VSD, and he was diagnosed with a new hole in his heart at 13, and he's now 15, and we didn't have any more information as far as what that actually meant. There was a female who was born with a VSD, and she was diagnosed at 3 months of age with left ventricular non-compaction, which we had talked about earlier too, and she's now 14, so she was doing well too. There was a female that was born with a PDA, and she was diagnosed at 5 with a dilated aortic and pulmonary root. That's what the person put, and she's now 19. And there was a male that is now 34, and he was diagnosed at 24 with cardiomyopathy. And there was another male that was born with cardiomyopathy, and he still had it at 25. And then there was the last female was born with a PDA and a VSD, and she had a left ventricle problem. We're not sure specifically what that meant at 13 years old, and that's how old she was when the survey was completed. So that just kind of gives us, again, it's not a lot of data, and we weren't able to, look at an ultrasound of the heart to see what's going on or get really clinical summaries of these individuals because we wanted to make sure everything was anonymous. But it kind of gives us a better idea as far as how common is this really, screening things, what we should look out for, things like that. So just starting to scratch the surface as far as what's to come in individuals with 1p36 deletion syndrome as they get older. So then we tried to ask questions as far related to puberty and what happens if it's delayed or if it's early onset, and physically how individuals will develop. And so we use the Tanner stages, which are an established, essentially a picture of physical development as an individual's going through puberty. And so stage 5 is the final stage when someone has completed puberty physically. Again, we weren't able to test hormone levels or things like that. Okay. So for males, the average age of onset in stage 5 was 12 years old, and for females, the average age at stage 5 was 10.9. And those are average, they're not early or delayed. We also asked about anything atypical that parents or primary caregivers felt during puberty was happening with that individual with 1p36. And so some things that were reported include early onset pubic hair, small testes, or some reported that he was developed very quickly or had small genitalia. And females that were reported, some said they had some early breast tissue or precocious puberty, and others reported that menstruation, once it started, it just never stopped. It was very continuous. They had a lot of excess bleeding. So those were some of the things that were reported, again, just to kind of keep in mind that we're hoping doctors and physicians will keep in mind. So puberty, what we kind of essentially concluded is that it's pretty variable and difficult to predict. So we're hoping future studies can really illuminate, what is the course specifically of puberty, or if it really is just variable across the board, because we do know that everybody is so different. So then we asked if anybody had reported been diagnosed with a cancer or tumor, and we know that individuals do get tumors or cancers, and so we asked our population, but nobody reported that they had developed any sort of cancer or any sort of tumor. So it's still certainly a risk because, again, we do know there are genes in the 1p36 region associated with cancer development, but it was not reported in our study. So then we asked about the ability to achieve independent mobility, meaning walking on their own. So we had an overwhelming majority were able to walk. 98% were able to sit independently, so just being able to sit unsupported. And we asked about bottom shuffling, crawling, and even out of those that were able to walk, 63% did not need wheelchair assistance to do so. And then 30% did, just for, whether or not it was shopping at the grocery store or things like that, but they still were able to walk on their own. Feeding independently, so that just meant, being able to eat their sandwich or use their hands to be able to eat, or be able to use a spoon or a knife or fork. And so to get a better idea of what the progression was, we first asked whether or not individuals ever needed a G-tube to help them get their nutrition when they were babies, and if they still needed them today. So 78% never needed some sort of G-tube or NG-tube as babies. And out of those that did, so about 20% needed a G-tube and 3% needed an NG-tube, so through the nose, as babies. But out of those that did, so we only had 4 that were still using a G-tube. So individuals were able to transition out of a G-tube and be able to take food orally or formula depending on their nutritional needs. And so we asked, even if they had a G-tube, did you consider that they were able to get the majority of the nutrition orally, so again, through their mouth? And 95% of individuals were reported that they were able to do so. And we also asked just if they were, as far as fine motor skills, able to hold a cup or a spoon. And so out of everybody that responded, they all said, yes, this individual can hold a cup or spoon. And when we, again, asking about feeding themselves. And so 86% out of the respondents reported that the individual with 1p36 Deletion syndrome was able to feed themselves. So like I said earlier, there wasn't really good data as far as individuals being able to be potty trained and use the bathroom, so we asked about that. So it was pretty split. About 43% could use the bathroom fully toilet trained for stool and urine, and 8% were toilet trained for urine only. And then not toilet trained was about 48%. So it was pretty split. And then we also asked if anybody had accents, and so that was reported as well. Out of 20 individuals that did report being able to be toilet trained for one or the other, 40% did have some accents. So then we asked about speech and communication because, previously reported, like we said, individuals pretty universally speech is delayed, and so we wanted to kind of characterize that a little bit better and see if that was the case, or if individuals were able to achieve some sort of communication. So 44% of individuals were reported to be verbal, so we tried to characterize that by how many words they were able to say, and 12 out of 17 that are able to talk in our study were able to use over 100 words. Which is a much bigger number than had been previously reported. And then we also asked if they were able to use sign language as a means of communication. And so we filtered out those that were used sign language only as their form of communication, because some individuals did both, were able to speak verbally and use sign language as communication. And so just those that exclusively used it, 37%, so 14 out of 37, again, thinking big picture, were able to use sign language as their only form of communication, so still able to communicate. And we also, again, asked if they were able to imitate sounds, so even if they weren't able to formulate words, but still had some sort of vocal communication, so 77% were able to imitate sounds. And we know, again, that behavioral concerns have been reported. And so we just tried to characterize that a little bit better, which proved to be a little bit difficult. So certainly we would encourage future research in this area as well if it is still a concern. But we know that there have been reports of aggressive or self-injurious type behaviors, and we didn't really see that in this population. Never was the most common reported for self-injurious. It's still, we would consider something to be aware of, but not one of the most forefront problems. Most individuals seem to be attention-seeking or very happy. So, like we talked about, as far as the health concerns, so thinking systemically, we did kind of come up with the same sort of statistics that had been previously reported, thinking about vision problems or hearing problems. We also noted that seizures can persist into adulthood, but they did decrease. And also, we found that hypotonia can still persist into adulthood as well. So that's something to certainly be aware of. And we also, again, went through those case reports of people that did develop some sort of heart disease or something. So it's certainly another thing to be aware of and screening appropriately for. We also were able to show that a lot of individuals are very mobile or able to communicate in ways that hadn't previously been reported. So that was really exciting and something we were really, really happy about. And, again, that some behavioral concerns still exist, but more research certainly would be needed in that area. So what did we kind of conclude? That proper medical care and support is really important, especially starting at a young age, to make sure that individuals will live as healthy of a life as they can and a very fulfilling life as well. And they definitely make significant developmental progress, especially considering what's previously reported. So we felt very good about those results as well. And nothing had previously said these individuals can live an independent life, be able to go to school, be able to have some sort of a job. And so we feel like with this data and with hopefully more future research that will come of this data, that the literature can show more of a kind of a positive spin than what's previously out there, because I know a lot of people are told, at initial diagnosis, it's not a very good outlook. And so we were very happy with this outcome, and hopefully future research again continues to show that it's not that type of an outlook, and individuals certainly can make some sort of awesome developmental progress and be able to live an independent life. So, kind of already talked about this, but continuing, there's still lots we don't know. And this was just, like I said, skimming the surface on what we don't know, but we still have a lot more we don't know. So we certainly would also want to talk about obesity, because there have been reports of obesity linked to 1p36 deletion syndrome, and we did not evaluate that in our study. And so we also think formal speech evaluations to try and pinpoint what is going on as far as the delay and what therapies or interventions can best help individuals to be able to communicate. Those certainly would be great to do, and really just any sort of additional research done by clinical geneticists, by researchers that are able to better characterize each individual area, because it's just kind of a broad overlook.